Hi, my name is Jolyn and I'm a physiotherapist trained in oncology rehab. Today I'll be sharing on chemotoxicities and how you can manage and overcome them. If you are a cancer survivor undergoing chemotherapy, or if you know someone who has cancer and is undergoing treatment, it's important that you know how chemotherapy works and the kind of effects that it has on the body. For every effective treatment, there will be side effects. Chemotherapy is essentially the use of drugs to stop cancer cells from growing, dividing, and making more cells. But at the same time, it damages healthy cells. This damage causes side effects associated with chemotherapy. There are two main toxicities that I'll be covering today: cardiotoxicity and neurotoxicity. Firstly, what is cardiotoxicity? There is direct damage to the heart muscle and function caused by certain drugs, and it can occur during treatment, within days or months or even years after treatment. It can reduce quality of life and pose a risk for potential heart diseases. Does all chemo drugs cause cardiotoxicity? The answer is no, but ask yourself one question. Do you have a history of heart disease? And ask your doctor two questions. Do you have risk factors for heart disease? And is your chemo regimen cardiotoxic? So now, what can you do to combat cardiotoxicity? Aerobic training. Any kind of activity that works your heart is a form of aerobic training. This includes walking, cycling, and swimming. Depending on your age, medical history, and previous lifestyle, it's important to note that everybody's starting line is different. Speak to a doctor or physiotherapist to find out what is safe for you. Well, let's take walking for a start, which is also the most common among individuals with cancer. First, pick an environment that is safe for you. Indoors, outdoors, leveled terrains, unleveled terrains, slopes, steps, in a fitness gym using a treadmill or stationary bike. Secondly, set a target. How do you know that you're working at the right intensity? What is the right amount for you to work your heart endurance and strength? 5,000 steps per day may be very different for someone else. Number of steps per day, therefore, is not a good measure. Instead, let's try to use a simple 1 to 10 scale called the Rate of Perceived Exertion, RPE scale. If you are currently undergoing treatment, you should aim to be at a level between 2 to 3, which is at a light intensity, where it's easy to breathe, and you can fairly well carry a conversation while doing the activity. If you have finished treatment and are recovering, you should aim to be at 4 to 6, which is at a moderate intensity, where breathing is a little difficult, but you still can hold a short conversation while doing the activity. At any point in time during the activity that you choose, if your RPE is 7 and above, you should consider to slow down or pause for a rest. Working too hard, too quickly can sometimes do more harm than good. Next, what is neurotoxicity? Neurotoxicity is damage done to the nervous system when the brain is exposed to toxic substances. In this case, chemotherapy have the potential to alter normal activity in the nervous system. Again, this can occur during treatment or within months or years after treatment. The main problem caused by neurotoxic drugs is peripheral neuropathy. A risk factor that makes one vulnerable to peripheral neuropathy are individuals with diabetes, where they already have pre-existing neuropathy problems. Why is it so hard to prevent this phenomenon? Due to medical advances and cancer research, people can tolerate higher doses of chemotherapy, people are living longer, so they start to experience later effects. So what can we do to combat neurotoxicity? And I particularly want to focus on what I've mentioned earlier, chemo-induced peripheral neuropathy, CIPN for short. Signs and symptoms of CIPN include numbness, tingling, pain, burning sensation, feelings of stiffness and weakness, especially over the hands and the feet, usually starting from fingertips, and toes. In more severe cases, individuals with CIPN will tell you that they feel like they are wearing gloves or socks. Now, assuming somebody has numbness in their feet with their sensation affected, what is the problem with this? They might experience balance problems, difficulties in walking, and are at high risk for falls. As we all know, falls can lead to serious consequences, especially in older adults. So what can we do? Number 1, wear proper footwear. Soft covered shoes are often recommended to prevent blisters, cuts, and wounds, especially when sensation is affected. Number 2, stretching exercises. Stretching helps to improve circulation and often helps to warm muscles up. It can also reduce risk of injuries while exercising. The two main leg stretches are calf stretches and hamstring stretches. Number 3, balance training. This is super important. As a physio, I like to train my patients with CIPN on uneven terrains, such as using soft foam cushions or rocker boards, as well as train their reaction strategies using perturbations and specific strengthening exercises. I would highly encourage you to engage a physiotherapist to personalize an exercise program that suits your needs, your current needs, as well as your future goals. Remember, your cancer journey is not easy at all. Unfortunately, chemotoxicities is part of that journey. Some have it better, some have it worse. Regardless, there's available support for you. For me, it's through sharing this video. If it's helpful, do go on to share with someone who may benefit from this. Thank you.